Hello all, my name is Anna Nuvais and I am the Acting Secretary of the Rhode Island Executive Office of Health and Human Services, also known as the OHHS. Our agency is responsible for administering the Medicaid program in Rhode Island and is coordinating our state's Medicaid renewal process. My organization and the McKee administration are committed to ensuring a successful renewal process so we maintain our historical low uninsured rates in Rhode Island. As you may know, annual Medicaid renewals started again on April 1st. Renewals help the state confirm that everyone on Medicaid is still eligible for that coverage. Annual renewals stopped during the COVID-19 federal public health emergency to help make things easier for our residents. But now, the federal government has asked that we begin the process in an annual basis again. We know that about a third of Rhode Islanders currently get their health insurance through Medicaid. This is a big part of the state. And we also know that many of our Medicaid members come from some from our state's more vulnerable populations. They may be an older adult, a parent with children, or an individual with disabilities, or they may be someone who is experiencing homelessness. That's why we are working with community partners like you to help make sure we are reaching these and other priority populations in ways that are meaningful and are effective. We expect that many of our state's Medicaid members will still be eligible for that coverage. Those who aren't will be transitioned to low-cost insurance options. By working together, being proactive, and communicating thoughtfully, we can make sure that all of our Medicaid members can be ready and stay covered. In Rhode Island, we are proud that 97% of all of our residents have health insurance. Our uninsured rate reached an historic low of 2.9% in 2022, far below the national average of 8%. To ensure that our state maintains its high rate of coverage, one of the best in the nation, we are working closely with the Department of Human Services, the Office of Healthy Aging, and the Health Source Rhode Island throughout this process. During this presentation, you are going to hear from Kristen Souza, the Medicaid Program Director here at OHHS, Lindsay Lang, the Director of Health Source RI, and also Kim Brito, the Acting Director at the Rhode Island Department of Human Services. My esteemed colleagues will tell you more about this process, what Medicaid members can expect, and how you can help spread the word about renewals. You can also learn more about Medicaid renewals and download informational materials by visiting our website, staycovered.ri.gov. Thank you for your time and collaboration.
Hello, I am Kristen Souza, Rhode Island Medicaid Director.
Hi, everyone. My name is Lindsay Lang, and I am the director at Health Source RI, the state-based health insurance marketplace.
Hi, everyone. Kim Brito here, and I am the director at the Department of Human Services.
Hi again. My name is Kristen Souza, and I serve as the state's Medicaid Director. Over a third of Rhode Island residents currently receive Medicaid coverage. We greatly appreciate everyone's partnership as we identify every avenue possible to get the word out to all Medicaid recipients. Today, we will review the following as it relates to our state's Medicaid renewals process: what you need to know, how renewals will work, what to expect in the mail and when to take action, and what partners are doing to help members. First, what you need to know. Before the COVID-19 pandemic, each person's Medicaid eligibility was reviewed once a year. This process is called a renewal or a redetermination. During the public health emergency, or PHE, the federal government paused annual renewals to make sure that people did not lose health coverage during the pandemic. As part of the last federal omnibus spending bill, Medicaid renewals were decoupled from the PHE, and all states must now restart their renewal process. On April 1st, Medicaid renewals began again in Rhode Island. Renewals will take place over the next 12 months. Please note that the renewal process we discuss here today will only affect health insurance coverage. It does not affect other public benefits. As you see in this chart, renewals will be spread out across the next 12 months, and the annual renewal process will begin again in March of 2024. In other words, you will be renewed once this year and then every year thereafter. Of special note here are households with children or just children who will not start their renewal process until December of 2023. I will now pass things over to Director Lang, who will go into more detail about how the renewals will work.
Great. I'm going to walk through a little bit about what current Medicaid customers can expect their renewal pathways to look like. And then I'm going to talk about how HealthSource RI fits into the picture to make sure as many Rhode Islanders stay connected to coverage as possible once Medicaid renewals begin again. In terms of the Medicaid renewal pathway, while we want everyone to be comfortable and familiar with the general process, the reality is it breaks down into really two different pathways. First, a passive renewal, and second, an active renewal. So first, I'm going to talk about passive renewals. This means that the state has all the information that we need on file. We can check eligibility by pulling refresh data from our data sources, which is a long-standing practice states have used over the years to support eligibility and enrollment. We expect this kind of renewal to cover about 150,000 members, which is a sizable portion of the overall population who will need to renew. Medicaid members in this bucket will simply receive notice that they've been renewed, and unless there's an error in their information, they don't need to do anything else to continue their coverage. The second group, active renewals, will also cover about 150,000 people. This group will receive a notice as their renewal date approaches in one of the 12-monthly groups that Director Souza described, and they'll be told that additional information is needed. That notice is going to give them a clear process and guidance on how to submit that information to the state, and we'll talk a little bit more about that shortly. The bottom line here is our goal is to keep as many Rhode Islanders connected to coverage, and in doing so, keep our historically high level of insured individuals, which is now over 97% insured, covered as possible. So that leads me into our next slide. This is where HealthSource RI takes up the baton to support those who no longer qualify for Medicaid. This is what the state marketplace is really built for. We connect Rhode Islanders with high quality, low cost health insurance. Right now, we help about 29,000 individuals and family customers. And when they're ready to transition, we will help anyone who is losing Medicaid coverage who's eligible to come through HealthSource RI, pick a plan, and enroll. I really want to hit home the word affordability with HealthSource RI. Right now, federal tax credits, which is federal financial assistance, is at an historic high. We connect 6 out of 7 of our customers with those federal tax credits. And tax credits can be used every single month to reduce the cost of your premium. After tax credits are applied, Over 30% of Health Source RI customers pay under $20 a month for their health coverage. As we anticipate the needs of many Rhode Islanders making the transition to coverage through Health Source RI, this administration has put even more supports in place, so I want to talk about those. And I'm proud to share that around the country, as states prepare for renewals to begin again under the Medicaid program, Rhode Island is really being regarded as innovative in our efforts to help transition people when they need it from Medicaid to coverage through the marketplace. First, we're fortunate that with our shared data system, our back-end system, every Medicaid enrollee who no longer qualifies for Medicaid is going to get a warm handoff to Health Source RI. Their notification will be designed to make sure they know exactly what they can do to continue coverage through Health Source RI after they lose Medicaid. Every notice will be customized to give them exactly what supports are available based on their income level and the different ways that they can explore getting covered through Health Source RI. We have a lot of different customer service channels, and we want to make sure people understand how to reach out and get help. Every single person who loses Medicaid eligibility and is eligible to come through Health Source RI will also get a 60-day special enrollment period. This is an extra opportunity outside of our annual open enrollment period to come through Health Source RI and pick a plan. You can open up that 60-day SEP special enrollment period anytime during the entire 12 to 14 months that this renewal period is kicking off. Through the governor's budget initiative, those whose income falls below 250% of the federal poverty level, and you can see those income examples here on the slide. It's about $69,000 a year for a family of 4, will be provided with 2 months premium assistance above and beyond the federal tax credit assistance I've already mentioned. The state will pay whatever it is the individual and family would owe after those federal tax credits are applied for 2 months to make sure that you have coverage on the first day after you lose Medicaid. That premium assistance can also apply to dental coverage. It's our intention that this 2-month buffer will give people the information and the time that they need to adjust, having come off of Medicaid and needing to budget for that monthly premium going forward. We also go further than that. A subset of that population, so now we're talking about people with income under 2 times the federal poverty level, will be automatically enrolled into a silver level plan through Health Source RI. Again, that income level is provided for you on the slide. It's about $55,000 for a family of 4. This is an additional way that we're trying to target our efforts to help those who might be most at risk of losing their coverage or having a gap in coverage, and helping ensure that they don't. Those who are auto-enrolled will have 60 days with that premium assistance in place to explore other options that are available through Health Source RI. You can call us and get help comparing your options. You can change your plan, and you can also cancel your coverage back to the first day that you had it through Health Source RI if that doesn't feel like the right fit for you. As I mentioned, even among the households who exceed these particular income brackets, the majority of Health Source RI customers receive significant tax credits to bring down their monthly premium costs. So I want to make sure we get that message across. Going on to the next slide, I just want to recognize we're often asked, how much does a plan through Health Source RI cost? The answer is it's a little hard to answer that question with one simple response because your costs can differ based on your age, the size of your household, your income level, and what type of plan you'd like to choose. On this slide, though, you'll see some examples of coverage costs for customers who are leaving Medicaid and joining a plan through Health Source RI. I'm not going to go through all of them, but for an example, a single adult who is age 40 and falls at about 175% of the federal poverty level will be eligible for auto enrollment into a silver level plan through HealthSource RI, and that state premium assistance that we're adding during this period where Medicaid renewals are beginning again. This means they're not going to pay out of pocket for their premium. And they'll also receive that federal financial assistance in the form of advanced premium tax credits. Once that additional 2 months assistance is over, that individual will pay only $26 a month for that silver level plan through HealthSource RI. Looking across, you can see that family plans, the selection of a different metal level, silver, gold, we have bronze level plans, and the tax credits you're eligible for, which are based on income, make the out-of-pocket monthly premium different for everyone. So we've provided a couple of examples here. But again, I just want to reiterate, there are a lot of different options available through HealthSource RI. There is federal financial assistance, which is always available through those advanced premium tax credits. And it's our goal and our mission to help you find a plan that fits your needs and your budget. So we urge you to reach out to HealthSource RI. Keep on the lookout for those notices that explain what you're eligible for. And if you're helping somebody who's receiving those notices, know that you can reach out to HealthSource RI as well, and we will help answer all your questions about getting covered through the marketplace. Now I'm going to hand it over to Director Brito to walk through a couple of slides that focus more directly on what members can expect to receive in the mail and when they should be taking action.
Thank you, Director Lang. That's exactly what I'm going to do, talk to us a bit more, focusing on what the members can expect to receive in the mail and when to take action on the renewal process. So in the slide, the most important step that Medicaid members can take right now is to update their contact information. So that's their mailing address, their email, their phone numbers. This really is one of the most important steps in the entire process, and it will allow us to communicate with members directly, and it will ensure that they receive the key information as this renewal process unfolds. So if a member has not yet updated their contact information, we're showing different ways on how they can do so. So contact their managed care organization. This includes Neighborhood Health Plan of Rhode Island, Tufts Health Plan, Rhode Island Together, or our United Healthcare Community Plan. So they can go online, they can access their accounts at healthyroadri.gov, or go through our Healthy Road mobile app, where they can also sign up for our convenient text messaging option. HealthSource RI also hosts a live web chat, which is staffed during business hours. So members can visit healthsourceri.com and tap on the bubble that says chat with us. And of course, members can reach us by phone at the number listed for HSRI on this slide, and in person at our DHS field offices that are located across the states. So our next slide gets us to look at the layout of the letters and the notice sequence that we are using to connect with our constituents. So letter 1 is our Medicaid, all Medicaid households received a letter in the mail, and also some via email who have signed up for email on file, informing them about what they can do now, how to protect their information, and explaining the process for renewals. Notice 2 is going to be on a green notice that goes out to 4 specific population benefit groups. This indicates that they will have a slightly different process with separate instructions than what was included in letter 1. This is also referenced in letter 1. Notice 3 is going to be on a yellow notice. There will be 2 versions, 3A and 3B, which will indicate that either the member is being passively renewed or that we need more information, and that member will have to return to us within 60-day time frame in order for us to process their renewal. Notice 4 is a reminder for those who receive the notice for a full or active renewal. They're going to receive this notice. if we have not received their information within a certain period of time prior to that due date. Notice 5, households will receive this notice when we have received their information and are reviewing the application or the decision is pending. This is to ensure confirmation of receiving their application to avoid excessive calls to our offices or to check if we have received it. Notice 6, this is our benefit decision notice. This notice informs individuals that they have either been approved or that their benefits are denied. Within the denial letter, there will be options for additional coverage depending upon the situation and circumstance and how to purchase that coverage. So letter 1 communicates the message to be ready and stay covered. It includes an introduction to the renewal process and that it will be starting in April, what action enrollees need to take, and what they can do to protect and report information on fraud. We also have a new website, which is our www.staycovered.ri.gov, which is a central hub across all of our agencies' websites. This enrollees can find the latest information related to Medicaid renewals. Our informal slogan is "Be ready and stay covered." This site pulls all information from our interagencies, our Executive Office of Health and Human Services, DHS, HSRI, and we've added additional tools there as well. There are frequently asked questions. There's an overview of the renewal process. Members can also check their Healthy Road accounts to see their estimated renewal dates. So finally, to round out this portion of our discussion, let me also touch base on how easy it is to submit some of these important documents for our customers might be asked for throughout the process that has been outlined. So this slide does nicely illustrate the options, but I'm going to highlight them for you. The Healthy Road portal and the Healthy Road mobile app have recently been enhanced to make uploading documents quick and easy. Customers can always drop them off at any of our DHS offices as well, which are statewide, both in person and through our secured drop boxes that are at each location. Documents can also be mailed to the address listed on the slide, and we also encourage our members to try out our new document scanning center, which is located at one of our DHS field offices at 1 Reservoir Ave in Providence. It's located in the lower portion of the building, has its own entrance, and it's a quick and easy option to help simplify this process. So at this time, I'm going to turn the presentation back over to Director Souza to continue our discussion. Thank you.
Thank you, Director Brito. Finally, today, I want to discuss how incredible partners are at helping us reach out to and support Medicaid members through this process. First, we have a robust group of existing field supports available to help Medicaid members through the renewal process via various outreach and engagement efforts. HealthSource Rhode Island's navigator agencies provide free assistance for navigating health insurance. Our health equity zones, some of our most trusted members in the community, are on board to help quell consumer concerns and help members understand their renewal notices. Certified application counselors at our local hospitals, clinics, and other organizations will provide in-person renewal assistance. In our managed care organizations, Neighborhood Health Plan of Rhode Island, Tufts, and United Healthcare Community Plan serve approximately 90% of Medicaid recipients. They are available to answer questions. Members can reach out to the MCO by calling the customer service number on the back of their insurance cards. And our community-based organizations, such as United Way 211 and others, are always a resource to assist Rhode Islanders. Here you will see some of the priority populations those who may need additional support in updating their contact information or completing their renewal packets, and those we are most concerned about experience a lapse in coverage. High-density communities and unhoused communities, mothers, children, and the elderly, our BIPOC community, individuals with disabilities, individuals with behavioral health, substance-involved individuals, and formerly incarcerated individuals. To help provide additional supports, we have opened applications for mini grants available to organizations who serve these priority populations and who want to provide targeted services and supports. More information about these mini grants can be found on the website www.staycovered.ri.gov. Here are 8 of the key messages you will take with you for yourself, for constituents you may have, for friends, family, or neighbors who have Medicaid benefits. Renewals are happening in April. Families with children do not start their Medicaid renewal process until December. Please update your contact information now. Please ensure you keep it up to date. Make sure to open your mail and sign up for text messaging if that's available to you. Always protect yourself against fraud and make sure to report it if you suspect it. These changes affect health insurance only. Take action when you receive your yellow notice. There are options for continuous coverage available. And to remember, this will continue to happen every year from now forward. Thank you so much.
Thank you.
Thank you.